think about healthcare, you might first think about the expensive, acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect at home, work, in school, and with society? And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about important genital symptoms. Have you had pelvic pain? So it could be due to ovarian cysts or tumors. It could be due to a condition called endometriosis, where the lining of the uterus is outside the uterus. It might be on the fallopian tubes or in the pelvis. So it can cause menstrual type pain, but really widespread and very painful in the pelvis. It could be due to benign growths in the uterus called fibroids, or it could be due to pregnancy or vaginal infections or sexually transmitted infections. So pelvic pain is treatable and should not be ignored. And for women, are your periods irregular, heavy, or painful? So that could be due to, again, fibroids or endometriosis. It could be due to hormonal conditions common around the time of menopause. And of course, it could be related to pregnancy and breastfeeding as well, or hormones. If women lose a lot of weight and lose body fat, it's not uncommon for them to stop getting periods. And that's certainly not healthy for them, but that's one of the symptoms. Have you had any abnormal vaginal bleeding or spotting? So again, it could be hormonal, but it could also be a sign of cervical cancer. So spotting or bleeding at irregular times or with movement should be checked out. Do you have any groin or genital sores, swellings, or growths? So you can commonly feel your lymph nodes, so you know what they feel like in the groin. But if you had some unusual swelling or tenderness there, sores, even if they're not painful, can be a sign of a serious infection or a cancer. Genital warts present as growths that get bigger, usually a different texture. And most people look in those areas in the dark. If you're not sure, always check with your doctor.